Assalamu alaikum everyone. In this video we are going to talk about pericardial effusion. So what is pericardial effusion? Any cause of the pericarditis that can lead to exudation of the fluid into the pericardial sac or the pericardial space. In simple words, we can say that exudation or accumulation of fluid within this pericardial space is called pericardial effusion. Now look at this diagram that how outside the heart is pericardial space, which is formed by the inner visceral pericardium and outer peripheral pericardium. So in between these two pericardium, if the fluid is accumulated, it is called pericardial effusion. There are multiple causes of pericardial effusion, which includes any cause of the pericarditis, like any infectious causes includes viral, bacterial, or fungal infections can cause exudation of fluid into this space. So other causes includes congestive cardiac failure or chronic heart failure, cirrhosis of the liver. In the cirrhosis patient, there is a loss of albumin synthesis. So due to decreased synthesis of the albumin, there is decrease on cortic plasma pressure. So due to decrease on cortic pressure of the plasma, there is exudation or there is accumulation of fluid within this pericardial space. In the nephrotic syndrome, there is a loss of protein into the urine. So ultimately decreased plasma on cortic pressure and pericardial effusion develops in these patients as well. Now come to the clinical features. So there is a outside the heart there is a fluid accumulation. Due to the fluid accumulation outside the heart, there is muffled heart sound in these patients, and there is soft point of maximal impulse, that is soft cardiac apex beat. The Evard sign is another clinical feature which is very important. It means that on the percussion there is a dullness at the base of left lung. This dullness on the percussion may be due to the compression by the pericardial fluid. That if the base of the left lung is compressed by this pericardial fluid, then this is called Evard's sign. And the other important sign is pericardial friction rub. It is high pitched scratchy sound which can be heard by the stethoscope. It may be positive or negative in some patients because it is the early sign of pericardial effusion, especially it is a sign of pericarditis. So in early stages it may be positive, but in advanced stages it cannot be heard. So this is basically a sign, friction rub is basically a sign of pericarditis. Now come to the investigations in case of pericardial effusion, which includes the gold standard investigation, which is echocardiogram. So it is an investigation of choice or gold standard investigation. It confirms the presence or the absence of significant effusion. The other investigations includes chest X-ray, which shows the large globular heart, or which is in common words we can say that water bottle shaped heart. But here this point is very important to remember, that in the chest X-ray there is no pulmonary edema as in the cardiomegaly due to heart failure, because in the heart failure patients there is large globular heart along with the pulmonary edema signs in the chest X-ray. But here in the pericardial effusion there is simple water bottle shaped heart but no pulmonary edema in the chest X-ray. The other investigations includes ECG. Cardial effusion is electrocardiogram, which may shows low voltage QRS complexes, and in very high volume pericardial effusion, so it electrical alternance can be seen. This is due to the to and fro motion of heart within the fluid. Like this, if heart is moving in large volume of the fluid outside the heart, then it moves to and fro motion. So due to and fro motion, there is electrical alternance, which means that some QRS complexes are of low voltages like this, they are low voltage, and some the next other QRS complexes are of high voltage. So there is a difference in the QRS complex voltages. This is called electrical alternance. It is prominent in very high volume pericardial effusions. The other diagnostic investigation is pericardiosynthesis, that is removal of some fluid from this pericardial space for the diagnostic purpose. So in order to check the proteins, glucose, cell counts, and differential cytology and specific gravity and hematocrit from this pericardiosynthesis from which the fluid is taken for the diagnostic purposes. And now come to last but not least, the management of this pericardial effusion. So the management includes treat the underlying cause, like if pericarditis, treat the underlying infections in this case. So treat the cirrhosis can cause improvement in the pericardial effusion, and treatment of nephrotic syndrome can also improve pericardial effusion in these patients. So treatment of underlying cause is important. In very severe cases or very high volume pericardial effusion cases, sometimes pericardiocentesis is needed, that is fluid removal. Not in all the cases, it is very rarely performed procedure. It is this pericardiocentesis is mainly diagnostic in case of pericardial effusion. In very severe cases, only sometimes pericardiocentesis is performed, not in all the cases. So this was whole about the pericardial effusion. Thank you so much for watching this video.